Hey, good morning, and welcome to Open Mics with Dr. Stites. It's Wednesday, February the 8th. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. After being married for a while, you think you know your spouse pretty well, right? But imagine what would happen if that person's personality started to change drastically to the point where they become almost a whole different person, and nobody can figure out why. That's what happened to one area couple who split up because of this horrible change. But as Jessica Lovell shows us, the pair found the help they needed to not only save a life, but also save their marriage.
Love is patient.
Love is kind.
It does not envy.
Risa and Chris Kafka have a hallway full of memories.
Here's our wedding picture.
It's what you'd expect after 3 grown kids and 37 years of marriage.
We just had a great time.
Until 4 years ago, when something unexpected happened.
I was like trapped in a body that was dying, and I knew inside that I was dying. But I couldn't figure it out.
Risa had a drastic change in personality.
I couldn't tell what I was doing. I was acting really bizarre, just in a frenzy almost. Frenzy of shopping, a frenzy of buying things.
But it was more than that. Chris says his wife became cruel and hurtful.
She was yelling at her friends, and and they would call me crying. She'd never cussed or cursed before, and all of a sudden she was doing that a lot more often.
Thinking it might be the wear and tear of marriage, Chris hung in there, tried therapy, tried everything. Nothing worked.
I didn't cry for 3 years. I couldn't shed a tear. It's like I had no emotions.
A family physician, Chris was used to helping others, but was unable to help his wife. He was ready for divorce.
I was at my wit's end.
But Dr. Kafka had one last thought.
I got one of my partners to order the MRI, and that's where we found that she had a leak.
A cerebrospinal fluid leak that neurointerventional radiologist Dr. John Matarang thought he could treat.
The CSF leak is notorious for being a very frustrating thing to figure out. The hardest part is really to find where the leak is.
Dr. Matarang was the first in the region to perform a new, less invasive way to treat a cerebrospinal fluid leak. He accessed a vein in Lisa's leg to deliver a type of liquid sealer to her spinal veins.
And it just sort of plugs up all these little nooks and crannies where the veins are and where the CSF could potentially leak into.
Dr. Matarang told Chris he could fix Risa's leak, but he was not a miracle worker. How wrong he was. Within hours, Risa's personality changed back.
Within 12 hours, she was walking different. She was completely different. And she went from being this unhappy, mean woman to being the person I married.
And then this.
Literally within 36 hours, she says she loves me.
And he just forgave me so quickly. He forgave everything.
Chris credits Dr. Matarang for saving his wife and his marriage.
I feel like I get a do-over. I get a second chance. And I just want to do it better this time.
Love does not delight in evil, but rejoices with the truth.
It always protects, always trusts.
Always hopes, always perseveres.
All right, well, we are so very glad to have Risa Kafka and her husband, Dr. Chris Kafka, joining us remotely this morning. Welcome to you both. Okay, so I start to tear up. I watch you people tear up. Okay, that is an amazing, miraculous story. Also, so welcome to you both. Also, welcome to those of us here in the Dolph Simons Jr. Family Broadcast Studio. 2 of Risa's doctors, Dr. John Matarang, a neurointerventional radiologist at the University of Kansas Health System, and Dr. Jennifer Chang, a neurosurgeon here at the health system. And of course, Doc Hawk will be here to give us our latest COVID count. We're going to see if our numbers continue to drop. They are across the country. Thank you all for being with us this morning. Okay, Risa, that was an incredible story that we just saw about you and your husband. Tell us about when you first started feeling something wasn't right.
Well, physically, I had a lot of different symptoms. I don't know if it was because my brain was not at the right place, but I had a lot of physical symptoms around my body. I couldn't tell that my personality was different. It was like I was in a different consciousness. And I just remember during the recovery when I felt like this veil was just lifted, and all of a sudden I realized everything. Although I do have a lot of memory lapses, I remembered things that I did like throughout the years. And it was very painful to face all of that. But I just feel so grateful that I'm still here and I get another chance.
That is amazing. So did your condition just kind of continue to get worse and worse once it developed, or did it sort of just develop and it was there?
No, it progressed rapidly during the last few years to the point where I was barely functioning.
And were you conscious about the change in behavior that you were experiencing?
I'm sorry, I didn't hear you.
Were you conscious of the change in behavior that you were experiencing?
No, I was not conscious of it at all. And as a matter of fact, when Dr. Mattering asked me if my personality had changed, I couldn't see anything. And I had to ask several people that were close to me, my children, a friend that's a nurse. I'm like, has my personality changed? I asked my parents, and everyone was like, yes. But I couldn't see any of it. I couldn't see it at all.
Wow. So now, Dr. Kafka, that change in your wife's personality must have been pretty alarming. As a family physician up in the Northland, have you ever seen anything like this before?
I have never seen that. I've been in practice for about 32 years, 33 years, and have never seen or heard anything like this before.
You know, Dr. Kafka, I got to tell you, I think I've shared a few patients before. I know you've been an outstanding physician. And I'm a pulmonary critical care doc. You're a family medicine doc. I will tell you, I would not have thought about this. This is not high on my differential. And as we say in the medical world, and I'm not sure I would have ever thought about it. Did you think maybe there was some psychological cause for the change, like a new psychiatric disorder like bipolar disease or something?
Well, that's what I was thinking. And of course, the last thing you want to do is, diagnose your own family with psychiatric problems. It's one thing to diagnose strep throat,
and that's a very dangerous thing to do.
That's right. So I didn't want to do that, but at some point last summer, I realized that I thought there could be something wrong besides a psychiatric diagnosis, and that's when the MRI was ordered.
So what made you think about doing that MRI? Was it just sort of a last-ditch deal, or you couldn't figure it out? Maybe she had some funny brain tumor. What made you decide to do that?
Well, there were some events that occurred that summer, and we spent a weekend together at a wedding. And I finally realized at that point something. It was like I was hit in the side of the head, and I realized there was something that had changed. And I thought, well, I better make sure there's not a tumor or a stroke in that part of the unknown part of the brain that might be causing that. Yeah. And that's why I got one of my partners to order an MRI.
Yeah, that is amazing. So, Dr. Cheng, talk to us about cerebrospinal fluid. What is it? What's its function? Why is it there? And, of course, why does it leak?
Okay, so cerebrospinal fluid, or CSF, is a clear, colorless fluid that is generated in the brain and then circulates around the brain and the spinal cord and is reabsorbed in the brain. So multiple times a day in an adult, the entire CSF in our body is regenerated and reabsorbed. It does a lot of functions. It helps to provide nutrients to the brain and remove wastes. And it is cushioning for the brain. It kind of, by surrounding the brain and spinal cord, which is very soft, spongy material, it kind of makes the brain more weightless and cushions it, protects it from trauma. So those are just some of the things that it does.
So that's a lot of stuff that it does. But here's a key question. So if I'm being goofy, and my wife says to me, she's a physician too, so there's a little bit of a threshold I got to get across on my excuses. If I'm being goofy, do you think I could say to my wife successfully, honey, I've got a leak? Is that going to work?
Well, probably not.
Yeah.
Especially if that's your normal personality.
Yeah, it'd be a challenge. Okay, so what causes these kind of leaks?
So there's a lot of different things that can cause cerebrospinal fluid leaks, both within the brain and within the spine. So in this case, this is one within the spine. The most common being trauma. So trauma such as having a lumbar puncture or having a car accident or some sort of direct trauma. But there's other things like genetic diseases, like connective tissue disorders that could cause it, like Ehlers-Danlos or Marfan's. And then there's some other reasons that we don't necessarily know. It's thought that the linings of the spinal cord are just, sometimes they're weaker. In this case, there was a venous CSF fistula, which is kind of a newer entity that is being described more by people like Dr. Mattering.
All right, so I'm just going to clarify for our audience here. So what it means is that this fluid that encases the brain and the spinal column and is in communication with each other, it's like one big column of fluid, right? Somehow a vein around there and that fluid got a connection that's not supposed to be there, and so the fluid was leaking into the vein.
That's correct.
And what was the level of that? Was it like high in the brain or down in the spinal column?
It's
or
in
was
the
it?
cervical spine.
Okay, so up here kind of in the neck. So
Yes.
really she was like a pain in the neck at that point in some regards. All right, Dr. Mattering, we have Risa scans both before and after treatment. Tell us what we're seeing. What's going on here?
Well, the image on the left, these are MRI images. The one on the left is after contrast, and the one on the right is without contrast. And essentially what this is trying to show is that you can see the difference over the lining or the surface of the brain on the on the left side. You'll see this white, it's called enhancement. It's the take-up of the MRI contrast. And on the right, we don't see that. So essentially what that's showing is that when you have a CSF leak or low CSF pressures, you can have this reactive, they call it pachymeningeal enhancement.
Okay,
which
that's
is what
a big term. You're going to have to define pachymeningeal.
Well, it's just it's a thickening or reaction of the membrane around the brain, and having low pressures or low volume of the CSF can present that way on imaging. So that's one of the things we look for. When you see that, that sort of kind of comes to the top of your brain. Could this patient have what they call CNS hypotension when you see that type of enhancement or thickening of the enhancement over the surfaces of the brain?
So what happens, you just used an interesting word about this. You said hypotension, CSF hypotension. Now I think about hypotension when I was in the ICU for many years, not enough blood, not enough volume, all sorts of problems. You got to give people back that volume and make sure they can sustain their life. In this situation, there's hypotension around the brain.
Correct, yeah. So it's sometimes a little bit of a misnomer because some people think it's actually hypovolemia because there are mechanisms in the brain, the nervous system, to essentially equalize the pressure. So even though you might do a lumbar puncture to get a gauge of how high or low somebody's CSF pressure, that could indicate maybe a leak, your body can adapt to some degree and equalize those pressures, whether it's distension of the vein or other mechanisms. But the main part is you're losing the fluid, whether it's a loss of volume and or loss of pressure. That's what sort of is the cascade to start having some more of these symptoms that can be pretty wide presentation of symptoms.
Okay, so Dr. Ryan, tell us about the substance you used to stop the leak. As we heard, you're one of the first people in the region to use this.
Yeah, so what we use is a substance called Onyx. Onyx is it's in a family of what we call liquid embolics. Liquid embolics is something that you can inject inside of the body, typically to stop or block a vessel, artery, or vein, and that's what we use. Onyx is interesting in that it's a spongy-like substance. When it reacts with the blood, it becomes spongy, almost looks like we describe it acts like lava, the way it flows, and it kind of goes into these small veins. So the key is that we want it to penetrate all these little small channels or venous connections to the CSF that where we think the leak is. So you can't actually see exactly the exact point of the leak, but you just know where the leak is. So your job is to go in there and put enough of this substance that you're blocking all the possible channels where the CSF can leak into.
But it doesn't block well, I guess it does block the small veins that are in that area.
Correct, yeah. You can block quite a few veins, and the body has a way of rerouting the veins that are blocked to other normal routes. So it's not that big of a deal to block a few small veins around there.
Okay, so I've heard this is used in bathrooms. Is this really true? That you're using the same thing as Onyx stuff is actually a bathroom sealant as well? Is that true?
I don't know that much about home repair.
Yeah, neither do I. That's why I'm asking you the questions.
So, but it's a compound called ethylene vinyl alcohol. It is an industrial substance. Typically, they use these things. It's very foamy and soft. They use these things in sporting equipment, padding, ski boot padding, boxing gloves, things like that. So it has this foamy quality to it, soft, so that it can sort of seek out these channels inside the body. But it's in that family of compounds, and that's exactly what it does. It forms a cast inside of the artery or vein. It doesn't actually stick to the artery, it actually just sticks to itself and sort of crawls through all the little channels. It's what they call a non-adhesive liquid embolic.
That is a pretty amazing story. So just to say, what you've just talked about is not being somebody who's in home repair. My wife would say I'm in home disrepair, and that I'm really good at that as it turns out. Dr. Chang, do we know what it is about a CSF leak that causes someone's whole personality and behavior to change like that?
So in this case, because of the CSF hypotension, she had sagging of her frontal and temporal lobes, which caused a phenomenon that's kind of like a frontotemporal dementia. So essentially that can lead to things like personality changes, difficulty with memory, and things like that. So this is, I would say, pretty rare, but it has been documented before.
That is pretty amazing. So it is like that. And is there ever any danger that this could be permanent if left too long?
So we know from case reports and from this patient that it can be reversible. But I think if you leave it too long, then ultimately you could be dealing with, in the long run, possibly life-threatening consequences.
Oh my goodness. Okay, so besides the personality change, are there other features of a CSF leak for our audience to know about?
Yeah, so commonly people can see things like positional headaches that get worse during the day. The longer you're up, the headaches get worse, and then when you lay down, it gets better. People talk about things like dizziness, nausea, sometimes cranial nerve deficit, so things like facial weakness, hearing changes, tinnitus, ringing in the ears. So there's a whole variety of different things that can happen, but I think the positional headaches are the most common.
Man. So, Risa, did you have some of these, do you have headaches as well as part of this?
At one point, I had severe headache, but eventually they went away just as fast as they came on. And I never could figure out why, but that was the main period of headaches. Most of it was just, I was so exhausted all the time, and I would just fall asleep a lot.
Man, I'm still struck by the story here. So describe your feeling you had after the procedure, Risa, when you realized you were back to your old self again.
Well, it took a little bit of time. As time goes on, at first there were very drastic changes, but it was very rough at first. It was not an easy process to go through, and but the changes were so significant. Just feeling better, and the pain that I felt in my body, like with different issues I was having, pretty much completely disappeared. So as time goes on, I feel like I'm still recovering and getting better, and my thinking's getting better. My thinking was very cloudy at first, and my balance was very, was not normal. So as time goes on, things are getting better and better. But it took me a minute. I think I realized right away, it was only a few days before I felt the emotion of love. And I hadn't felt that, for my husband, or I'm not sure I really felt it for anyone for a long time. And so I did immediately notice the change in my emotions. And of course that meant, I cried a lot. All the emotions were there. So there was sadness, there was fear. I hadn't felt fear in a really long time. And so it's a process. I'm still healing. Yeah. What did you say to your friends?
Yeah. What did you say to your friends?
I'm sorry. I had a lot of apologies. And I'm just so amazed. Most people did forgive me. I mean, there's probably still some relationships that I need to try to repair, but everyone just forgave me.
Yeah, that is one of the great things about love, isn't it? Dr. Kafka, getting your wife back has to be one of the greatest feelings in the world. And how has this experience changed you, or changed your ability, or how you are as a physician?
I think, when you're in family practice for a long time, you get a little maybe tired of hearing the same things, and difficulty with long-term problems has made me a lot more tolerant and hopefully more open to just the patient, talking to him and figuring out what's wrong with them, and realizing that people have a lot of unusual symptoms that we can't figure out, and that happens to every physician. But I think just listening to people, being a little more patient, a little more humble, has made me hopefully a better physician. I'll never see this condition again. It's very rare, and in family practice we talk about things that we see in our lifetime, and as a career, and we'll see a lot of cancers and different things like that, but I'm sure I'll never see something like this ever again.
Yeah, well, you'll be prepared to diagnose it if you do, that's for sure. Unfortunately, the school of personal, what was the other thing? Experience may be the best teacher, but only a fool learns from no other. So I hope not many folks have to learn from that, but that's a tough thing. Dr. Matarang, Dr. Kafka credits you for saving his wife and his marriage. What do you think?
That's great news. I was very happy to hear that, obviously. I was really happy that, Risa, you were able to get back to feeling like yourself. And just, we all put this together. It's a new treatment, so there was a lot of, there's some unknowns. I had to reach out for some references and a little bit of guidance from people that have done this, but everybody, the whole team, we were able to put this together, and I'm grateful we were able to do that and treat her here locally, because it's, like I said, it was a new treatment, but we were able to apply a lot of things that we knew from the past to this new treatment. So it's an exciting area to be working in.
Have you seen other cases? Have you had to do any more repairs?
So I've now done 12 repairs like Risa's. So that's, again, they're not common, but they're probably what I think are underdiagnosed. Really, the tough part is just to find these leaks, to have the clinical suspicion to look for them, and then the second hard part is to actually find them. Truthfully, the treatment part, when we're in there injecting the Onyx, is probably the most straightforward part of the whole thing, to be quite honest.
And did these other people have personality changes like Risa experienced?
No, there was one other case who was actually pretty far advanced. In fact, that patient, they were working them up for acute dementia, and they had actually bleeding on the brain because there was so much sagging, there was tearing of the veins, causing some bleeding over the surface of the brain. And once we started, one of our colleagues, Dr. Camerata, actually had a high suspicion that this person might actually have a CSF leak. So we went down the whole road of working it up, and sure enough, we did find a leak. I think it was the second patient that I treated this way, and he responded great, just like Risa did. Within a month or two, the bleeding actually resolved and all the findings that we see on MRI also resolved, and he's back to essentially baseline. So that was an eye-opening experience when I saw that case. That this is something that can be very helpful if you can find it in the right person.
Okay, so this is one of the best. I've been on the program. We've been doing this for almost, 3 years or whatever. This is one of the most impressive stories I've seen, and certainly one of the most miraculous. I'm sure today's topic has spurred a lot of questions from our viewers. Get yours sent in to us now on YouTube, Facebook, Twitter, and the Medical News Network. You'll find links to those right here on your screen. Jessica Lovell will join us in a few moments with those questions. It's time for us to check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention Control. How are the COVID numbers looking here at the health system, Doc Hawk?
Yeah, hi. It's good to be here. We've had some ups and downs
over the last week or so. We know that mostly for the past couple weeks, we have seen a decrease from the 40s really to kind of where we're sitting now and have been for a little bit. We have 53 total of those. It's 26 active. We've kind of been holding in that mid-20s. Of those 4 in the ICU, still 2 on the ventilator. So
yeah, just to say, those are 2 hospital units. They are not insignificant numbers.
Yeah.
Although I'm pleased we didn't see some terrible post-Christmas, post-holiday surge. I thought we were both a little concerned about it. But the numbers continue to drop nationwide. You can see this on the heat map today. There are still some hot spots, and you can see where those are. But overall, the map is far quieter than it was at this time last year when it was really awful. And even about 6 weeks ago, it was much worse. So, you know, we're in a much better time, but we have to remember there's still a lot of COVID out there, still probably 3 times as much as there is influenza. So it's, you know, it's still a big deal. Hawkeye, a couple of topics to run by you a little bit this morning. We've been hearing for years that humans have becoming more and more resistant to antibiotics and our ability to treat bacterial infections because of the resistance of bacteria. According to a report in Nature, the use of antibiotics in animal farming, which is a major contributor to antimicrobial resistance, is expected to continue to grow by 8% at the end of the decade. Talk about that problem. What are we going to do?
Yeah, I mean, so bacterial resistance is a major issue. It's a major issue for you and your colleagues in the ICU, major issue for me and my colleagues, but most importantly also for the primary care providers that are out there giving outpatient antibiotics to people with infections who really need those antibiotics. We are seeing more and more drug resistance pop up in those bacteria. There are several factors leading to this. There are several factors leading to increased resistance rates. Certainly one of those factors is the widespread use of a lot of antibiotics in those farms to help grow those animals, those herds, whether it be chickens, cows, anything else that we would use to keep them healthy so that they can grow up and then be obviously harvested and sent to slaughter. So, but this is one of the major issues, and we are seeing a lot of the use of antibiotics, but we can also detect this in our wastewater as well and in our rivers and streams, so it's not just a benign incident. We are finding antibiotics in the environment. When that happens, those bacteria then, as we come into contact with those antibiotics, we are able to select out for bacteria that become resistant to those antibiotics, and that's the real issue here. We know antibiotic resistance in hospitals and in infections is a significant issue. This is one part, and this is what the Nature article talks about. This is one major part driving that as well. And so we really need to continue the research and investigation into new drugs, but also ways to help stem the velocity, that change in that antibiotic resistance profiles of many different bacteria.
You know, this thing about interaction between animals and the environment and humans, we have to make sure we stay aware of. I saw that article sent to you this morning about the this new strain of avian flu, or what we call bird flu, H1N1. It's a form of influenza, and it's not the same question as the antibiotics per se, but it is something that happens as a result of how we do things to the environment. In this case, these large groups of mink farms, where animals are very close together, sharing these viruses that then mutate and potentially could infect humans.
Yeah, and I think that's the point there, is that really this was the first large-scale transmission from mammal to mammal that we've seen of this avian influenza. We have reported on cases before. We know that cases occur sporadically of the bird flu in humans. You know, it seems to be about 30 to 50% fatal, so it is not a benign disease process either. The most recent one, I think, was last fall or last summer, was in Colorado in a worker in a poultry farm. He did okay. He's still alive. But what we have here in this article that you sent, Steve, is the fact that now in mammals, so not birds, but mammals, they are seeing it spread from each one of those animals to each other. And so that does raise concern. That is an issue. We know that there was a huge coronavirus outbreak early on in the pandemic in mink farms as well. And the concern is, number one, now, does that virus get the ability to spread from those mammals to other humans, and then can humans spread it to other humans, but also any other mutations that may take place that may increase its severity or anything of that nature?
Yeah, the avian term here, birds, avian flu is actually a misnomer about, because in this case it's around all the animals.
Yeah.
So, Jess, I bet there are some pretty important questions from our viewers out there today. We have pretty remarkable program.
Yeah, you know they are. As you had mentioned, this is one of the most interesting programs we have done, and such a fascinating story. Christy wants to know, Dr. Matterang, do we know what caused Risa's leak?
No, I don't think there was any history of trauma in that area. It was probably what we call idiopathic, or just a spontaneous leak in that area in her cervical spine. So yeah, I don't know exactly why it was there, but it did happen.
You know, Dr. Kafka, our whole team here today, we all know that the term idiopathic in medicine really means we don't know yet. Someday we'll know, but you know, there are a lot of things that we used to call idiopathic that now we can describe as we know them, but some things we're still stupid about, and still a lot of things. Don't just think, Dr. Kafka, idiopathic really in medicine, doesn't that just mean we really just don't know yet?
We don't. I tell you, this is one of those weird things that just happens, and it will continue to happen in medicine. And like you said, as we know more things, we figure it out. And 20 years ago, we had different diagnoses. Now we know that they're not true anymore. And so hopefully this will become more aware and we can recognize it. But I still suspect that it's going to be difficult to find. And I still remember in medical school, talk about look for horses, not zebras. This is an odd zebra.
It is. I think that whole thing was, if you're standing on the plains of Wyoming and you hear thundering hoof prints, look for horses, not zebras. In this case, though, every now and then there's still zebras, even in Wyoming, Jess.
Okay, so Angela wants to know, does this have anything to do with intracranial hypertension?
Okay, interesting question, Dr. Chang, because there is intracranial, which you can get normal pressure hydrocephalus, and you can start seeing personality changes and things like that. So it's a little similar.
Yeah, so it still is a disorder of the CSF. Intracranial hypertension is sort of the opposite, of the situation where we're talking about the spontaneous CSF leak causing intracranial hypotension because of the loss of the CSF. So if you have too much CSF, either due to overproduction, under reabsorption, or something else, then you can have quite a lot of problems with that. So that is can be also life-threatening, can cause headaches. In this case, it would be the opposite, where lying down would be worse. So you would wake up with a headache rather than having your headache get worse during the day. But it can also lead to nausea, vomiting, seizures.
Challenges walking, your movements aren't as good, you're a little unstable, coordination kind of goes out. Yeah. That is an amazing thing. The brain is a very sensitive thing. I don't really think about this, the brain pressure, or the CSF, or however you guys say this. I'll call it the brain pressure, for lack of a better term. But this brain pressure thing, I don't think about that. Obviously, as a pulmonary doctor, I don't see it very often, but you all got to be seeing this a lot, and it's something you must have to think about a lot.
Yeah, I think that we have different ways of trying to determine what the pressure is. We do lumbar punctures. We have our ophthalmologist look at the eye and look for signs of intracranial pressure there. I think that in this case, someone has these different changes in their personality, and things are just not right. So I think what, from a primary care perspective, was the right thing to do is to get an MRI as a workup, because the MRI showed those pachymeningeal enhancements, that finding, and that with we had the right level of suspicion to say, hey, that's not normal. Should we try to find out why? And then that's where Dr. Matterang was involved in the diagnosis of this.
So the pachymeningeal thing is the lining around the brain, so to speak, and yeah, that pressure thing is pretty amazing. So from the time the MRI was done to the time you said, I think this is a CSF leak, let's go do something about it, how long was that?
Oh, the turnaround time, I think, was probably a week. Well, I think the MRI was done at an outside hospital, and once we saw that and the suspicion was raised, she was brought to KU, and Dr. Chang consulted us to say, hey, I think this person has a CSF leak. We should do some steps to try to find out what type of leak it is, and then if we can find it, what is a plan to fix it. So that's when we got involved.
Wow, so from the scans, you made the diagnosis, and you said, I think that's what this is. Yeah.
Yeah, from the scans, you
Plus
know,
the presentation.
Yeah, I mean, I think no, it was really the scans. I mean, I think if someone just said there's these, you know, personality changes, I wouldn't first think CSF leak. But then, you know, an outside physician called me and said, I have a patient, and this is the MRI finding, and I thought we should bring this patient in for treatment, so or for diagnosis. So we brought them, admitted them to KU, and then I, just like Dr. Mattering saying, I consulted him and said, hey, can you try to find out where this CSF leak is coming from?
All right, Jess.
Angie wants to know on that note, Risa, even though you didn't realize you had those personality changes, were you willing to get the MRI? What was that conversation like between you and Chris when he presented that as a possible solution? Were you willing to do it?
Yes, I was willing to get the MRI, but I didn't exactly know what they were looking for because I had continued to go to the doctor for other symptoms. And so I wasn't necessarily thinking at that point in time that it was a leak. I really didn't know.
Gretchen says, she says, I'm 11 years out from brain surgery that she had here at the health system for Chiari malformation. Just wanted to know if the doctors would comment on how much CSF blockage can affect people. She says that her symptoms were very similar to Risa's.
Dr. Cheng, so the Bud Chiari case.
So Chiari, so in her case, actually, in Risa's case, the spontaneous CSF leak actually caused something like a Chiari malformation because it kind of drew the cerebellar tonsils, part of the hindbrain, down through the normal opening in the skull inappropriately. So that can, for a typical patient who has Chiari malformation, people can have a really intense occipital headaches in the back of your head that are worsened with any sort of straining like coughing or bearing down. People can develop tingling or weakness in their hands and gait problems with Chiari malformation. So, and that is also a CSF problem. There's difficulty with the CSF circulating right at that junction between the skull and the spine because of this inappropriate descent of the cerebellar tonsils.
So in that case, the brain's getting sucked into the spinal column, and so that also can cause changes.
Right. Well, and also with Risa's case, if you looked at her MRI, that was another finding that the cerebellar tonsils were descended below where they should have been, and because of the CSF leak.
And so to our audience out there, the tonsils are part of the brain that's in the back of your skull that gets sucked into the spinal column, and yeah, either way you go, that's not a good thing. We call that bad. Jess.
Couple more questions. Kim wants to know, can CSF detect Alzheimer's?
Can CSF itself detect Alzheimer's? I don't think so.
Well, so I mean, that's a topic that is of a lot of interest that people are trying to figure out what are sort of biomarkers, early biomarkers for Alzheimer's before people have sort of irreversible damage. So there's a lot of thought that CSF can be certainly an integral role, play a role in Alzheimer's. I mentioned that part of the function of CSF is to remove the waste products from the brain. There's some thought that as people get older, with CSF circulation not being as robust, that there can be this inappropriate buildup of waste products that could be part of what leads to Alzheimer's disease.
That is pretty amazing, Jess. I did not know that, and so now we're going to think about the CSF like we're thinking about urine. If you don't have the right circulation, you don't have the right elimination for it, things don't go well, Jess.
Last question is from Brian. He's asking, if you have a CSF leak and you get it fixed like Risa did, does the body naturally produce more of that fluid to make up for what was leaked?
Yes. So the body generates the CSF fluid constantly. So it's constantly generating it, and then the fluid circulates and it's being reabsorbed. So I think in an adult person, like 4 to 6 times a day, the entire volume of CSF in our body, which is about 150 mils, is produced and reabsorbed. So someone's constantly making CSF, but in the case where we have the leakage, they can't keep up with that, with the loss of CSF.
And most of the time, that CSF is absorbed and then eliminated as a waste product in itself, right? But in this situation, it was going through the veins, and so it was leaking out faster than the body could produce it.
Correct, yes.
Yeah,
there was an imbalance.
That is pretty remarkable. Okay, so Risa, I had another question for you. I saw a photo back there with a bunch of children, a bunch of family. How has your family responded to this outside of your husband? But how about the rest of your kids? I just made your husband sound like one of your kids. Oh, that's probably true.
They're very grateful because they had noticed the change, and it had made our relationship very strained. They were embarrassed to go out with me in public because of how I was acting and the things that I would do. And so I had been kind of excluded from family gatherings. And obviously it had separated my husband and I physically and emotionally. So once the repair was done and the process of healing began, my kids immediately returned with love and gratefulness. And actually my daughter, who lives in the Northeast, she just came to visit this weekend, and we just had the best time. I mean, it was just amazing.
Yeah, this is the miracle of science, isn't it? That is amazing to me. I want to thank our guests for this great conversation. I want to thank them especially for being brave about to come up and tell their story about their own relationship and about health and about healing. So that this has been just a terrific program. Let's get some final thoughts. Risa, we've got to start with you.
I'm just so grateful. I can't even express it. I mean, I feel like I have a second chance in life, and I want to do it better. I want to be a better person. I want to give back more because so much has been given to me, and I feel so grateful to the doctors, but as well as, my God, because I feel like he just opened doors and made opportunities that are, to me, a miracle. I feel like I've been given several miracles. The fact that I'm still alive, and then the fact that my brain is healing itself. So I'm just really grateful.
Thank you. Dr. Chris Kafka.
I'm very thankful as well. And it's been a journey. And, as a family physician, we see all sorts of different things, just like you do, but I have never seen this. And I'm humbled to know that, we all missed it. I did, our doctor, the other consultants, and but I'm very grateful for modern medicine that I'm quite grateful that KU has built a neuro hospital and has decided to continue to do things that we would not normally do in another hospital system. So I'm grateful, and I'm humbled before God, and because I certainly wasn't reacting the right way as a loving husband would be, but I'm just very thankful. The whole experience at KU was great, and I'm amazed.
Thank you. Dr. Cheng.
Yeah, I think that this is just such an interesting case, and it's very instructive for all involved, especially for me. I haven't had 12 cases like Dr. Mettering has of this, and I've been here at KU for 5 years, and I just thought it was an interesting presentation, and I think that the step of getting the MRI was the right thing to do. And I think that if people have symptoms that are strange, like certainly having consultation with a neurologist would be a good idea.
Yeah, Dr. Mettering.
Yeah, I think having been around this now pretty closely the last year and a half, there can be a very wide presentation of how people feel, how they act. It's not just always the positional headache, the classic symptoms. I've heard people tell me memory loss, their walking is abnormal, personality changes, all sorts of things. Brain fog is a big one. I'm surprised. I know it's popular with COVID, but now the more I talk to people that potentially have a CSF leak, they talk about this brain fog, and Risa mentioned that as well. So it's a pretty wide presentation. Again, overall, it's a rare entity, so it won't be the first thing that everybody thinks about, but certainly we're equipped to sort of, if we get to that point, to try to find these leaks and work them up. So the type of leak you had was one of the more rare types, but again, there's a lot of exciting things treatment-wise and diagnosis-wise that we can do to find these leaks. I think in the past, we've probably missed a lot of these, doing different tests that just didn't help. So I think now we're getting into a new era of finding these leaks and being able to treat them in a non-invasive or minimally invasive way.
You know, it is, I'm going to turn back to this point about how we've developed this so much in medicine. But Dr. Hawk.
Yeah, I mean, just continuing to endorse what we've talked about, you know, certainly for the past couple of years, but also especially this week, have seen such great stories and care teams all working in collaboration to, you know, number one, get the diagnosis, find out what is ailing you, and then all working together to get you better and have that optimal outcome. And continues to say, you know, the University of Kansas Health System, why would you go anywhere else? Not only for the science, but just the compassion of the people that you are working with. So,
I'm constantly reminded of the crucible of life, and how that's a combination of many things for us. And in that crucible, we keep our family, and we keep love, and we clearly keep hope and faith. And when you put in a little science, we've said it before, that combination of hope, faith, and science is remarkable. And in this program, we've talked about new therapies for cancer, changing the way we do heart disease, and now a new way to treat a leak of spinal fluid that can change your personality and change your life. So in that crucible life, we have to have a little bit of science, we have to have a little bit of hope, and we have to have a whole lot of faith in order to make sure that we can continue to sustain all of ourselves and all of our families and all of our love. Jess, back to you.
Dr. Stites, thank you so much, and thank you to everyone for sharing their Chiefs photos ahead of the big Super Bowl weekend coming up. Check out this photo of Benny and Lola next to their humans, Taylor and Pat, gearing up for the big win on Sunday. You can share your photos in the chat or with KU Hospital on Facebook, or email medicalnewsnetwork@kumc.edu. I want to thank again all of you for joining us today and all of our guests. We will be back here tomorrow at 8 with a brand new episode of the Morning Medical Update. We hope you have a great day.
Coming up tomorrow on the Morning Medical Update, a bad night's sleep can do more than just make you tired. I'm Jessica Lovell, coming up on the next Morning Medical Update. More and more studies connect poor sleep with bad health. The best advice from doctors for sleep-deprived patients. That's Thursday at 8. I'm Alexis Del Cid. On the next All Things Heart, what are the odds of this happening?
If you could script who miraculously would accidentally show up on the night you had cardiac arrest unexpectedly, you couldn't have drawn it up any better.
A life-threatening event on his daily jog, and it's who else was there to save his life that's jaw-dropping. Thursday morning at 10.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.